Hi, and welcome to this screencast on practicing safe radiography. So, all safe practice in regards to taking radiographs hinges on this principle: the keeping your dose, any of your colleagues' dose, certainly the public dose, and the animal's dose as low as reasonably achievable. So that is done through following these three actions. So it's keeping an eye on your time. The less time spent with your finger on the button, the better in regards to radiography. A distance from the source, so 2 to 3 meters is what's recommended, provided you are maintaining your distance from the primary beam, you will be practicing safely. And shielding, so using lead protective equipment to shield your body from the source of radiation. So, with regards to time in radiography, it is all about um, taking less radiographs. So, making sure that your systems are working well, that they're consistent, that your machine is maintained and working properly, and that you're consistent with your practice, doing the same thing every time. Get to attention to detail, and every time you take a radiograph, make it the best shot. So there's no trial and error. You aim to always get the diagnostic quality image that you want the first time, minimizing repeats. This is where veterinary nurses can really make a difference. A veterinary nurse that um, undertakes extra training and practice and has a special interest in radiography can really make a difference to the quality of the radiographs that are taken. Learning the standard positions. So the idea is that you get a consistent image, the same every time. So every time that you take a lateral thorax, it's exactly the same. It's centered on the same landmark, and it's collimated out to include the area of interest only. There are standardized positions in any veterinary nursing textbook. It's a good idea to keep one in the radiography suite with you while you're learning, or print off some from that are available online, and just aim to practice consistently. That's how you get accuracy with your work, and attention to detail makes a real difference. Distance is how the main way we protect ourselves in veterinary radiography. So the recommendation is that you're 2 meters from the primary beam at all times whenever it is activated. Um, so in order to do this, you need your patients to be sedated or under general anaesthetic, and you need to have available and learn to use positioning aids. So, on having sedated or anaesthetised patients, this is obviously a decision that is a clinical decision and is up to the vet. Um, it is definitely the best way to achieve quality results. Most practices achieve this. So, by far the majority now of practices routinely sedate or anaesthetise patients for radiography. Those that are performing routine manual restraint are in the minority. It it's the best way to keep your dose as low as reasonably achievable. It's just by maintaining your distance. It's simple. There's a myth that it'll be quicker if we just quickly hold it and take it. Um, it is often you're sacrificing diagnostic quality in doing that. Repeats are common where you're holding patients. The myth of time saving um, is it's not the reality, is what I'm trying to say. If you have routinely sedated patients and nurses that know what they're doing are well practiced and efficient at radiography. It is quicker to sedate patients and get the image you want the first time in safety. Because the point is that low doses, which we would be exposed to in veterinary radiography, so the dose is fairly low, but the point is that it accumulates over time and practice, in your practice. So that is why it is best to maintain your distance. So here's a quote from the BSAVA manual of veterinary nursing. Sorry, excuse me, the BSAVA textbook of veterinary nursing. And this applies to situations where it's acceptable not to sedate patients. So very young puppies and kittens, patients with congestive heart failure, ruptured diaphragms or other severe traumatic injuries would be the times when the industry would deem it acceptable to perform manual restraint, not to save the owner money. So the risk of working around X-ray machines is scatter radiation. So it's not too difficult to stay out of the primary beam where the higher risk is. But what we're concerned about is radiation scattering off the patient, off the table, and those are beams that are going in all directions. So the best way to keep yourself safe from scatter radiation is to maintain a distance of 2 meters from the primary beam. A way to minimize it is to collimate properly. So collimate right down so scatter is minimized by using the light beam diaphragm to collimate down as low as you possibly can. So include only the area of interest is the point, and that's why we have these standardized positions with standardized landmarks that make sure that we can palpate those landmarks and get the area of interest every time by knowing where we're collimating to exactly on different sizes and shapes of patients. Scatter is a particular issue with larger patients. So the higher your kV, the kilovoltage on the machine, the more scatter you'll produce. So the larger the patient, it's more of an issue. So take care around, be especially careful to maintain your distance in larger patients. Grids are used to minimize scatter. So scatter not only is a safety issue, but it also causes image quality, so it can fog up your image. So on larger patients, usually if the tissue depth's larger than 10 centimeters or 15 centimeters on a thorax, which is for VIA, then you should be using a grid to minimize scatter. So there are some risks that are related specifically to digital radiography that have sort of come to the fore as we've moved, as the technology has moved. So one thing is don't crop your image after you've taken it. You should collimate and minimize scatter on the plate. So that is a point that it's really easy to crop the image afterwards. Well, you shouldn't be doing that. You should collimate every time to include only the area of interest. The other point is termed dose creep. So with digital radiography, the exposure index that will give you an acceptable image is quite wide. And what has happened, they've found in human medicine, as digital radiography came in, is that people have slowly increased the exposure factors because you can change up the image post exposure and it's quite forgiving. So the temptation is to make sure that you're penetrating the tissue well enough to get an image in the first place, and you can always adjust it after. So what has happened is they've found that slowly over time, exposure values or exposure factors have crept up. So it is certainly something that you should be measuring tissue and choosing your exposure factors carefully. And the other point that they've found in human medicine is that repeats have shot up. So in the old days, when you had to chemically process every X-ray film that you put through, the tendency was it was less likely that you took a repeat because it took a couple of minutes for you to produce the image, and by that stage, um, you were less likely to just say, "Oh, let's take another one." However, with the instant um, image coming through with the digital technology, it's really tempting to just say, "Oh, we'll just take another one because it only takes 5 seconds." So they've certainly found in human medicine that the rate of repeats has increased with digital, where you would think that it should actually fall because the images are such higher quality, and there's less scope for error with the old chemical processing used to cause a lot of problems. But yeah, it's counterintuitive. The fact is that repeats have gone up, so be very careful around that. The last point is that you should be wearing shielding, so you're either behind a lead wall, wearing lead protective equipment. Make sure you wear gloves if you're manually restraining. It is reasonably common for people not to, because it's quite hard to hold a cat with lead gloves on and those practical problems. People that just put the gloves over the top of their hands, those sorts of practices are not safe. If you're closer than 2 meters to the primary beam, you should be wearing shielding at all times. So the point is that it's up to you. Safe practice. You're the one who needs to look out for you in practice. If you intend to be a veterinary nurse for 15, 20 years, then you're at risk of low dose of radiation accumulating over those years if you're not routinely practicing safely. So no one person should be manually restraining an animal more than 3 or 4 times a year. That's the industry guidelines for veterinary nurses from the BSAVA Manual of Veterinary Nursing. So if you are manually restraining more often than that, then you should examine your practices and evaluate why that's happening.